Professor Matthew Cripps. I'm Programme Director of NHS Right Care. In my former life, I was a finance manager, and I joined the NHS in 1996 and the National Finance Management Training Scheme, and worked my way up to acting director level in commissioning over a number of years. Whilst I was in finance, something that I always felt frustrated about was the perceived need for me to be the one who held the rest of the team back in terms of its ambition and reform efforts, and the old adage about finance always being the ones who say no, and that led me to thinking about, well, how can we create a system where finance not only can say yes, but wants to say yes within their role and responsibilities. And for me, that was the use of financial and clinical variation data, triangulating spend opportunities to save money where there's inefficiencies, for example, with the opportunity to improve patient outcomes and increase quality in the system. So we went about with NHS Right Care developing a system that helps health economies to identify those areas, and I, as a finance person, led that where I worked. It doesn't have to be led by a finance person, but it's something that I felt strongly about, so I did. And as a result of that, we were able, in the health economies that I worked in, to make sure that our improvement programmes focused on areas that would increase quality and patient outcomes while saving money. It's allowed me and the other senior finance officers to deliver on their responsibilities. It also allowed us to say yes more often than we used to, and it also meant that everyone on our board or governing body, as they now are in CCGs, was comfortable with the programmes we were working on, because it didn't matter what your perspective was, whether you were a clinician, head of quality, accountable officer, director of finance, whatever it was, the programmes we were identifying as priorities ticked all the boxes, and that meant everyone was able to push in the same direction together. And that's now been built up into what we call the NHS Right Care approach, and is across the country in CCGs and health economies that have adopted it, helping to drive improvement in population level healthcare.